and thanks for listening today. This is the RX Daily Dose. Today's episode is being recorded on Friday, December 20th, and I'm your host, Ian Parnagoni. We update this podcast every week for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all of your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. End of the year always seems to be a slow time of year for the federal government, and that includes the FDA. This will probably be our last episode of 2019. We do have a few updates for you, so let's get right into them now. On December 16th, the FDA approved enzalutamide, that's brand name Xtandi, for patients with metastatic castration-resistant prostate cancer. The FDA previously approved Xtandi for patients with castration-resistant prostate cancer, and this will be the third indication approval for Xtandi. Efficacy was investigated in clinical trials enrolling 1,150 patients with metastatic castration-resistant prostate cancer, randomized 1-to-1 to receive either Xtandi orally, 160 milligrams once daily, or placebo once daily. All patients received a GnRH analog or had a prior bilateral orchiectomy. The main outcome measured was radiographic progression-free survival. Median PFS was not reached in the Xtandi arm compared to 19.4 months in the placebo arm. A statistically significant improvement was also reported on the Xtandi arm compared to placebo in time to initiation of a new chemotherapy regimen. The most common adverse reactions that occurred more frequently in Xtandi-treated patients in the trial were hot flush, fatigue, hypertension, fractures, and musculoskeletal pain. The recommended dose is 160 milligrams, that's 4 40-milligram capsules administered once daily, with or without food. The product will compete in the market with Zytiga and Erleada, which are already indicated for metastatic castration-resistant prostate cancer. We talked more about the disease in episode 3 when Erleada was approved, so feel free to check that episode out too if you want more information. On December 12th, the FDA approved Tofacitinib, going by brand name Xeljanz XR, for once-daily treatment of adult patients with moderately to severely active ulcerative colitis after an inadequate response or intolerance to TNF blockers. Previously, only standard-release Xeljanz 5mg and 10mg was approved for twice-daily dosing for ulcerative colitis. Xeljanz now has 3 indications, including moderately to severely active ulcerative colitis, moderately to severely active rheumatoid arthritis, and active psoriatic arthritis. Also on December 12th, the FDA granted accelerated approval for Golodirsen, going by brand name Vyondys 53, the first treatment for patients with a confirmed mutation of the dystrophin gene, a mutation seen in 8% of patients with Duchenne Muscular dystrophy. DMD is a rare genetic disorder categorized by progressive muscle deterioration and weakness. It is the most common type of muscular dystrophy. DMD is caused by an absence of dystrophin, that's a protein that helps keep muscle cells intact. The first symptoms are usually seen between 3 and 5 years of age and worsen over time. The disease often occurs in people without a known family history of the condition and primarily affects boys, but in rare cases it can affect girls. DMD occurs in about 1 out of every 3,600 male infants worldwide. People with DMD progressively lose the ability to perform activities independently and often require a wheelchair by their early teens. As the disease progresses, life-threatening heart and respiratory conditions can occur. Patients typically succumb to the disease in their 20s or 30s. However, disease severity and life expectancy vary. Vyondys 53 was approved under the accelerated approval pathway, which provides for the approval of drugs that treat serious or life-threatening diseases and generally offer a meaningful advantage over existing treatments. Approval under this pathway can be based on adequate or well-controlled studies showing the drug has an effect on a surrogate endpoint that is reasonably likely to predict clinical benefit to patients. This pathway provides earlier patient access to promising new drugs, while the company conducts clinical trials to verify the predicted clinical benefit. The accelerated approval of Vyondys 53 is based on the surrogate endpoint of an increase in dystrophin production in the skeletal muscle observed in some patients treated with the drug. The FDA has concluded that the data submitted demonstrated an increase in dystrophin production that is reasonably likely to predict clinical benefit in patients with DMD who have a confirmed mutation of the dystrophin gene. A clinical benefit of the drug, including improved motor function, has not been established. In making this decision, though, the FDA considered the potential risk associated with the drug, the life-threatening and debilitating nature of the disease, and the lack of available therapies on the market. As part of the accelerated approval process, the FDA is requiring the company to conduct a clinical trial to confirm the drug's clinical benefit. The ongoing study is designed to assess whether Vyondys 53 improves motor function in DMD patients with a confirmed mutation of the dystrophin gene. If the trial fails to verify clinical benefit, the FDA may initiate proceedings to withdraw approval of the drug. The most common side effects reported by participants receiving Vyondys 53 in clinical studies were headache, fever, cough, vomiting, abdominal pain, cold symptoms, and nausea. On December 18th, the FDA approved enfortumab vedotin, going by brand name Padcev, for patients with locally advanced or metastatic urothelial cancer who have previously received a PD-1 or PD-L1 inhibitor and a platinum-containing chemotherapy. Platinum-containing chemotherapy, PD-1 and PD-L1 inhibitors are standard treatments for patients with bladder cancer, the sixth most common cancer in the U.S. Urothelial cancer, accounting for more than 90% of bladder cancers, begins in cells that line the bladder and nearby organs. Padcev represents a new type of therapy for patients with advanced urothelial cancer whose disease has progressed on chemotherapy and immunotherapy. Padcev is a Nectin-4-directed antibody and microtubule inhibitor conjugate, meaning the drug specifically targets cancer cells. In this case, the cell adhesion molecule known as Nectin-4, which is highly expressed in urothelial cancers. Padcev was approved based on the results of a clinical trial that enrolled 125 patients with locally advanced or metastatic urothelial cancer who received prior treatment with a PD-1 or PD-L1 inhibitor and platinum-based chemotherapy. The overall response rate, reflecting the percentage of patients who had a certain amount of tumor shrinkage, was 44%, with 12% having a complete response and 32% having a partial response. The median duration of response was 7.6 months. The most common side effects for patients taking Padcev were fatigue, peripheral neuropathy, decreased appetite, rash, nausea, diarrhea, dry eye, and dry skin. Patients may experience hyperglycemia, regardless of whether they have diabetes or not, and blood sugar levels should be monitored closely in patients receiving Padcev. Patients should be monitored for new or worsening peripheral neuropathy and have the dose of Padcev interrupted, reduced, or discontinued if needed. Patients may experience eye disorders, including dry eyes and vision changes while taking Padcev. Healthcare professionals should consider prophylactic artificial tears and refer to an ophthalmologist for any new symptoms related to the eye. And finally this week, but might be the most significant update, on December 13th, the FDA approved the use of icosapent ethyl, going by brand name Vascepa, as a secondary treatment to reduce the risk of cardiovascular events among adults with high triglycerides. Vascepa's active ingredient is the omega-3 fatty acid derived from fish oil. This is the first FDA-approved drug to reduce cardiovascular risk among patients with elevated triglycerides as an add-on to maximally tolerated statin therapy. Statins are drugs used to treat high cholesterol levels and reduce the risk of cardiovascular events. High levels of triglycerides can play a role in the hardening of arteries or thickening of the artery wall, which can increase the risk of heart attack or stroke. However, the mechanism of action that contributes to reduce cardiovascular events among patients taking Vascepa are not completely understood. Vascepa's efficacy and safety were established in the study with 8,000 patients who were either 45 years and older with a documented history of coronary artery, cerebrovascular, carotid artery, and peripheral artery disease, or 50 years and older with diabetes and additional risk factors for cardiovascular disease. Patients who received Vascepa were significantly less likely to experience a cardiovascular event, such as stroke or heart attack. In clinical trials, Vascepa was associated with an increased risk of atrial fibrillation or atrial flutter, requiring hospitalization. The increased risk of AFib was greater among patients with a history of AFib or aflutter. Vascepa was also associated with an increased risk of bleeding events. The incidence of bleeding was higher among patients who were also taking other medications that increase the risk of bleeding, such as aspirin, clopidogrel, or warfarin at the same time. Patients with allergies to fish or shellfish should be advised about the potential for allergic reaction. They should discontinue treatment and seek medical attention if any allergic reaction occurs. The most common side effects reported in clinical trials for Vascepa were musculoskeletal pain, peripheral edema, atrial fibrillation, and arthralgia. Vascepa was initially approved in 2012 for adults with severe triglyceride levels. This supplemental application received priority review from the FDA. And that's all I have for this week. I hope you enjoyed today's episode. I'll include all links and resources in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you listened to today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day and have a great holiday season. See you all in 2020. Music by Joseph McDade.